Hello, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm here today with Lucy Angelini. Lucy's a physiotherapist. She works for Extended Rehab. Many of you will see Lucy when you come into the offices for your post-op rehab. She'll be the physiotherapist looking after you. So I've invited Lucy along today to talk about the rehab around surgery for a stabilisation procedure. So that it might be a labral repair, it might be a capsule plication, it might be a posterior labral repair, posterior stabilisation. So we're going to talk about that now. So Lucy, coming up to that operation, what should everyone be thinking about doing?
So, a lot of people have had an unstable shoulder for quite a while in the lead up to this surgery, and they would have had a lot of physio with their local therapist. So, a lot of people have this surgery because they're quite loose and have lots of movement, and so really getting your rotator cuff as strong as you can before you go into the sling for 6 weeks is what you should focus on.
Yeah, right.
Yeah.
Okay.
Getting your strength.
Yeah.
A shoulder that's been sore for a long time will tend to be sort of anteriorly tilted. You're sort of, good at protecting it. So just making sure that you've got really good scapular awareness, thinking shoulder blades up and back, and a nice strong cuff will help a lot.
Yeah, right. Good. All right. So they've had their surgery, and it's the next morning after, because you stay in hospital one night. The next morning you see the physiotherapist. What's happening in that visit in the hospital with the hospital physio? What should they expect?
Yes, you'll be seen by the St Andrews physios, and they will teach you how to take on and off your sling in a safe way. They'll show you how to have a shower and also how to get dressed. So all these things are really important in your day-to-day functioning for the next 6 weeks. They'll also show you some really gentle passive range of motion exercises for your shoulder. So we're allowed to move it, but we're not allowed to sort of stretch it forcefully. So we've got some very sort of strict ranges that we are allowed to stretch it for. And as well, we like to move the adjacent joints, so your hand and your elbow and your neck, we like to keep moving so they don't stiffen up as a result of being in the sling.
Yeah. And remember, the physios and the doctors are going to be concentrating on, the exercise you'll be doing and range of motions and so on. It's also important for you to get very clear in your mind the simple things, how to fit the sling. So we fit the sling in theatre. It needs to be fitted with you standing up, and that can't happen until the next day. So the physio will do that with you, fit your sling properly for you. Spend some time with the physio working out how to adjust that sling and how to put it on and off. Then how to have a shower, how to get changed, how to get dressed, how to put a shirt on. Those things, you don't want to get home and then realize you haven't really sort of worked that out and then worry and that you might be doing it wrong. The physio will take you through those things. So just get it clear in your mind with those simple things as well as the exercise you're doing. Remember, the exercises are on the website, so you can go there and look at the exercises if you forget them. And we also have got how to put a sling on, how to put a shirt on, how to have a shower. Those videos are there on the website if you need a refresher. So then they're leaving hospital that next 6 weeks, because they're going to be in a sling for 6 weeks. So if it's an predominantly anterior shoulder operation, it's like a labral repair or a Bankart repair, you're going to be in a sling. If it's a predominantly posterior shoulder operation, posterior stabilisation, posterior labral repair, you're almost certainly going to be an external rotation brace, which will have had fitted preoperatively, so that'll be fitted. So that'll be the two different things. The external rotation brace, the idea is we want you externally rotated because we want to take the force off the back of the shoulder. We want it to tighten up there. So we want it to be a little bit loose, relaxed, so it can tighten up. We don't want it internally rotated because that'll stretch the back of the shoulder and stretch it up. We want it to actually tighten up at the back. Whereas with the front of the shoulder, sling across the front is pretty fine because we're wanting this part of the shoulder to tighten up. So that's the difference there. So that's 6 weeks until they come and see us at 6 weeks post-op.
Yes.
What do they expect?
So at 6 weeks, when you come in, we're hoping that your shoulder's really tight. So don't worry. A lot of people come in and are worried because their shoulder's really tight. That's exactly what you want. We actually want your shoulder tight. Yeah. So that makes us relaxed.
Yeah. If I see you at 6 weeks and you've got a normal range of motion, I'm starting to sort of worry that the surgery's not going to work. The plan of the surgery is to tighten your shoulder, and a lot of that tightness you get is actually just the way your shoulder heals, and that is a little bit that's dependent on you and how you actually heal. But we want to start tight, and then we're going to stretch you up under the care of the physiotherapist so you get back to where you need to be. If you're totally loose at 6 weeks, we're not going to get a stable shoulder for you.
So when they come in at 6 weeks, we take them out of the sling, we assess their range of motion. And like you say, if they have a lot already, then we're very reticent to do a lot of stretching. But if they're super tight, then we give you an active range of motion program. We encourage you to start using your arm for all your light, normal day-to-day activities. Start using it to eat and to wash and to dress and to groom, all those kinds of things. We don't want you doing any heavy lifting while your shoulder's still healing, but using it for all your normal day-to-day things is a good idea. In terms of driving, once you come out of the sling, that's a common question. Then you can...
Yeah, you can't really drive for that first 6 weeks. One, I don't want you to, because you want to be letting that shoulder tighten up and heal up. And so if you're moving a lot, then that's too much. And also, Queensland Transport recommend that you don't drive for 6 weeks after a major upper limb operation. So there's we really don't want you driving for that first 6 weeks.
No, definitely not. Another thing that people ask a lot, because this is typically a younger, more active cohort, is, when can I start running? So once you come out of the sling and your shoulder's comfortable, definitely going for some nice walks and then adding in some running as tolerated.
Yeah. And at that 6 week visit, you'll find, there are, for me, in my mind, there are two groups of patients. There are those patients that have had a big injury playing rugby or water skiing or snow skiing or something, and they've dislocated their shoulder and they've torn off the labrum, they've got a big Hill-Sachs lesion, maybe even chipped some bone off. And then there's the other patients that the reason they've dislocated is they're very lax in the first place. They're very loose, they're very stretchy, and they've had a fairly minor injury which has put their shoulder out, and they've stretched up the capsule in a lot of times, may have torn their labrum as well. And that second group of patients, we want to be careful with them because it's very easy for them to stretch their shoulders up and to start to become unstable again. So if you're a patient that's really stretchy, I'm almost certainly going to be asking you not to stretch your arm and not to do any range of motion. And what we'll be doing then is just isometric strengthening. So just strengthening, your arm stays in one place and you're straining against a rubber band, or the physios will take you through that. Whereas the other patients will be more encouraging you to stretch your shoulder up in that first 6 weeks.
Yep, so at 6 weeks it's nice. We're getting your history, working out exactly which one of those groups you're falling into, and working out with your local physio what the best plan of attack is.
Yeah, some patients there will just be no stretching at all because we want you to tighten up because you'll just stretch up too much because your collagen everyone's collagen is different. Some people have very stretchy collagen. We've got to watch that because that will undo the good work of the surgery, and we don't want to do that. So then the next visit, between 6 and 12 weeks, a lot of patients ask me, how often should they see their physiotherapist?
So if you're someone whose range of motion has come back really nice and easily, you probably won't need a lot of hands-on, stretching. Whereas if you're in that other camp who had, just a traumatic injury, then you might need a lot of, say weekly physio sessions just to work to get your range of motion back. And that's something that you and your physio can really, work on yourselves. But on average, once a week is as much as you would need. Yeah.
Okay.
Yep. And then the 12 week.
12 weeks. So the next visit then is at 12 weeks post-op. And for me, what I'm looking at then is the range of motion, and we're fine-tuning rehab really at that point in time. And the overall plan is to progress you into a strengthening program, light weights at the gym really.
Absolutely. So making sure that they're comfortable, that they feel stable, their shoulder feels stable, that their range is functional, and really transitioning into, the strengthening phase, which is a lot more exciting. And looking at any return to play goals that they have, working out what
plan that out.
what sport they're returning to, what timeframes they have, getting an individualised program ready for in order to achieve those.
And again, I'm not looking for normal range of motion at 12 weeks. For me, that will make me nervous. That's just too quick. I want you to be tight at 12 weeks. We've gone for a shoulder that we're stabilising your shoulder. Your shoulder has been too loose, and we want it tighter. If you come in at 12 weeks and your range of motion is back, I'm really starting to worry that it's not going to work long term. We do not want to see full range of motion at 12 weeks. I would like to see the shoulder a little tight. And because it's an overall rehab program of at least 6 months. And so don't be disheartened at 12 weeks if you're a little tight. That's actually what I want and what I prefer. That is the pathway to a good result.
Absolutely.
Yeah.
Yeah. And then the next visit 6 months.
6 months,
Yeah.
yes.
And so a lot of questions at that appointment revolve around return to play, contact athletes when they're allowed to start doing that kind of thing. So full contact normally isn't until 9 months.
Yeah, I'm cautious. I think 9 months is sensible for full contact. I think 6 months is a little bit early. And that is similar to the ACL reconstructions as well, isn't it? I think 9 months is pretty standard there as well.
And so, yeah, between 6 and 9 months, you're really working on getting that last little bit of strength, proprioception, getting confidence in your shoulder, starting some controlled drills, but not uncontrolled contact until the 9 months.
I think that's a good overview of the rehab relating to stabilising a shoulder and posterior and anterior as well. And thanks, Lucy. Thanks for coming in and chatting about that. I think everyone should have a good idea from that. Thank you.